Hello everyone. We have many types of myths in our society, right? Especially when we go for pregnancy or after delivery, postpartum period or the postnatal period, carrying the baby. In this period, our ajis or ancestors have many myths. Don't know from where all they will get this type of knowledge, which are scientifically not proven or which are scientifically opposite, but they will be having this myths in those periods. One of the myth is after delivery the woman should not have water intake more. This is one of the myth which is running in a society, and many of my patients will ask whether I should have water or not. My aji will say, you should not have water, it will affect the baby. Or my mom will say, you should not have water, it will affect the baby's stomach. So whether it is true or not, many of my patients will ask me. So today we will discuss whether we should have this water after delivery or not. So, welcome back to Dr. Meenakshi's Medica. This is Dr. Meenakshi, BMS MDIU, Ayurvedic pediatrician. So, after delivery, has the woman's body will be went through many changes, hormonal changes, organ changes, everything. So, obviously, the woman's body will be sensitive. So, they say that if you have more water, what our ajis have with is the body will not cooperate in the form of recovery. But obviously, according to a scientific proven method, it is a myth. It is not correct that they should not have water. Actually, they should have lot of water to create the hydration in a body to prevent dehydration. The woman should have lot of water after delivery. As a nursing mother, one need 2.5 to 3 liters of water per day. Usually for normal persons, we will say 1.5 to 2 liters per day. But in nursing mother, especially while breastfeeding, the woman should have 2.5 to 3 liters per day. Women in many countries around the world have been drinking water content more after their delivery with no known harmful effects. In many countries, we have proven this. The technology have proven this, that without any harm, they are having water. But the matter is whether to have warm water or cold water. This is the question. In initial stages after delivery for a week or for a month, you can have warm water, that too why? To stimulate your Agni. Obviously, your Agni, there will be Manda Agni and Vata Prakopa, many changes. As I mentioned before, there will be many changes in body. So you can have warm water if you wish. It's that too not compulsory and according to the season. If you are in summer, obviously, you can have cold water or warmed cold water you can have. It's not compulsory that you should have hot water only. Purely depends on the season where you are and which water is comfortable for you. Or if you are in winter, then you can have warm water, that too if necessary. If your immunity is low, if you have a cold water, suddenly you will catch a cold, or respiratory is weak, your respiratory is weak, then you can go for hot water, or else obviously you can have cold water. Instead of these all, adequate hydration to your body will give nice product, will helps in production of the breast milk. Obviously, because how much water you intake, it will help the breast milk in production, and your breast milk will be good in collection. So if you have a less water, one thing, your body will be dehydrated, and also you will in production of breast milk will be deficiency, or there will be problem in production of breast milk. So obviously you can have lot of water after delivery. And another myth, what the scientific ongoing word is, if you have more water or cold water, there will be less recovery in your body. It will slow down your recovery in your body. It is obviously no, because as much as water you intake, the body will be dehydrated. For healthy persons also will say same thing, right? Your body hydrate so that there will be no any diseases occurring for you, right? We will say for everyone. Obviously, you can follow the same thing after delivery also. And even food, um, like they will say you should do patya, you should not eat that, you should not eat this. There is nothing such. You can first, as your agni will be disturbed, first 10 to 20 days you can maintain soft diet which is easily digestible. Later you can have of your choice, but see, because as your baby will be sensitive, some diet may hamper baby's stools or baby's health. So see for that, and you can have whichever you want on your choice. No any restrictions in diet. Instead, you should have all nutritious food for your health and for your breast milk. And in fact, if you didn't have the sufficient water for your body, then it may lead to one of the main reason, constipation, or else it can lower the production of breast milk. And not only breast milk, but it can lead to deep vein thrombosis, and it can lead to blood clots, and it will hamper the circulation of blood. These all may get affected if you have less water than your body needs. So, mommies, don't care about the myths and all. You can have water how much you want or how much your body needs, but keep in mind that cold water and hot water, whichever comfortable for you according to season, according to your area, have that, especially according to your body. If you are comfortable with warm water, then you go through that. If you are not comfortable, because if you are not comfortable with warm water, obviously you will intake less water. Again, with that intaking of less water, these are conditions you will suffer. So rather than having less water or having the discomfort, because although your body will be suffering with lots of changes after delivery, so at least intake of water, intake of food you do on your choice, so that your body will be fit, and your baby will be also healthy, and it will give sufficient nutrition or hydration to your body. So subscribe to my channel for more such myths and scientific proven health issues. And whoever newly delivered and whoever in postnatal period, kindly share for them this video so that they too will be getting idea that they should have water or not. Thank you.